Hi guys, it is Friday, February 26th. I'm a little bit late filming and uploading this week. I am Leslie. Welcome to Leslie's Cancer Confessions. I decided to hold off on filming until today this week because I had my regular monthly oncology visit, which entails having blood work and getting my Xgeva shot that I get every 4 weeks and my exam with my oncologist. This week I had some stuff that I felt was of concern that he needed to take a few minutes extra while examining me to check out. I've had a little bit more difficulty breathing the past couple of weeks. I've woken up a couple of times and had to take pain pills in the middle of the night because of very, very sharp stabbing pains that worried me so much when they happened that I actually woke my husband up and said something's wrong with me. And of course he couldn't do anything about it, but I wanted him to know that I was in pain, that something was going on, that I was having trouble breathing. Just because, I wanted somebody else to know in case something, went wrong or was wrong or more wrong than normal. So I've been keeping note of these extra symptoms. I've had really swollen gland in my neck that has been making me have a little trouble turning my head, and I'm uncomfortable. I've been wearing my sleeve, which pushes the lymph up, and I had wondered if maybe the lymph was, just building up in that spot and not draining. But my lymph node is really enlarged. My lung actually does have more fluid on the left side than had been noted in the past. If you consider your lung to be like 3 lobes, my lung situation has always been the bottom 2 lobes on each side, unilaterally on both sides. I have pleural effusions, but listening to my lung and thumping on my back to make the sound that if you were thumping on a drum, you can hear where it's more hollow and where it's more full. I have fluid in my left lung 2/3 of the way up, so I may require having some drainage done, what is called a thoracentesis. I've had them in the past. They're very uncomfortable. I'm very tired of being poked and prodded and having fluid drained from myself. I don't want to turn this into a rant video or a complaining video. This is what's happening. This is where I'm at. These are the things that I learned at my last checkup 2 days ago. I've been dealing with the lung situation since diagnosis, which will be 5 years ago on the 28th of March. So in 1 month, less than a month, I will celebrate my 5-year cancerversary. I didn't go to the doctor this week thinking that the issue would be my lungs. I knew I was having trouble breathing and I knew I had more fluid. My issue this week, what I wanted to make the doctor aware of, is behind my teeth on the upper part of my mouth and in the center of my upper palate, I have some swelling. Prior to being diagnosed with metastatic breast cancer, about 6 or 7 years ago, I developed what I thought was called a torus, which means like a weird tooth growth or a bony growth in my upper palate. It was on the right side, just slightly off center, where this bone protruded from my soft palate. It was very bumpy, it was uncomfortable, it was sore, and I went to my dentist who sent me to a surgical dentist, and I had already been diagnosed with breast cancer and had gone through treatment and had been more than 5 years out from being told that I was in remission from that, but I was concerned that somehow I had had cancer metastasize to the bone in my mouth. And going to the surgical dentist, I wanted him to be aware of that and to, treat it. But he felt that, no, Oscar, no barking. He felt that it was just a torus, and he gave me a mouthwash. No. A mouthwash to gargle with like 4 to 5 times a day that dissolved that and made it open a hole in my upper palate where the bone dissolved, and it just left a hole, and then eventually that skin tissue grew back over, and I have like it's, you can look at the roof of a doggy's mouth and see that it's different colors. I can look at the roof of my mouth and see where that spot was, that the skin is a lighter color than the surrounding skin where that tissue grew back. Anyway, I felt that 2 weeks ago when I noticed this, oh no, I have another torus growing, but then I noticed the entire line next to my gums and on my upper palate is swollen. It's like this. It's like, here's your teeth, right? And normally your palate is like this. But right behind my teeth, I have a protrusion, and then here's my upper palate curving like this, and then it's smooth behind the other teeth. It should be like this, but it's like this. That's the only visual image because I'm not going to show you my mouth. So when I showed my oncologist this, he immediately went from his normal joking, hey, you're doing good, your counts are just a little bit high on your tumor marker, but not enough to be concerned, to, okay, let me do some research on what medications you've been on in the past. And then he connected the dots with, I've taken Taxol and Avastin, which can cause necrosis of the jaw. My understanding was that was actually the jaw that would deteriorate in that. But since I've had issues with my upper palate, and it's all kind of connected jaw-wise, he wants me to go see a dentist. Since we just moved here to Illinois, I've been here 7 months. I haven't really connected with a dentist yet. I had my teeth cleaned prior to moving here. So it's time, because I go every 6 months to get them cleaned. I'm connecting with a dentist. I've spoken with the dentist, or actually the intake nurse at the dentist, explaining my situation. But before they make an appointment and have me come in, they want to talk to my oncologist, go over my history, and kind of see where he thinks they should be looking and what they should be looking at, and if they need to do any specific sort of x-rays, whatever. And I should be hearing from them on Monday after they've had an opportunity to talk to him to schedule an appointment. So that is all the update on me seeing the doctor this 8th cycle of Ibrance. I don't believe that this thing on the roof of my mouth is in any way connected to me taking the Ibrance that I've been on for the past 7 or 8 months. I'm on the 8th cycle, so 8 months. It's more connected to being almost 2.5 years on the Taxol and Avastin that causes things to happen in your body that may not work out or, appear for several years after you've taken it. And it's been 2 years, a little over 2 years since I took it. We will see. Maybe I just scratched the roof of my mouth with a tortilla chip or something, and it got infected or inflamed. So I'm hoping it's some minor little thing that is just been hanging around for the past couple of weeks, but chances are it's cancer/chemo related. And the reason I am sharing this with you is because if you are taking any chemo, all chemos have side effects and cause secondary health issues. But in the grand scheme of things, the benefits of taking chemo outweigh the side effects or secondary symptoms that it can cause. When they post on their websites at different medication companies or different medication manufacturers for chemo, they always have exhaustive lists of the possible side effects and long-term effects to you. And a majority of them are standard across the board for different chemos, like nausea, hair loss, vomiting, weight loss, weight gain, swelling, confusion, fatigue. Those all generally tend to be the things that are shared amongst all the different chemo drugs. But some chemo drugs have different side effects. The Xeloda had the hand and foot syndrome. The Taxol and Avastin caused high blood pressure and bone necrosis in the jaw. So you just really need to pay attention to what the things are that your current chemotherapy may or may not cause. Ibrance can cause blood clots to happen in the lungs. And since I have lung issues already, I pay super close attention to any new lung pains or any shortness of breath that is exceptional compared to my baseline, what I'm used to. So yeah, that pretty much catches you up on the health aspect of what I'm going through. Cycle 8 has been pretty uneventful. I'm on week 2 of cycle 8. I will finish a week from Tuesday and have a week off. So like the 7th of March, I think. I'm trying to picture the calendar in my mind. I think whatever that Tuesday is will be my last dose, and then I have a week off. I will be going for a CAT scan to have my lungs looked at and, my whole body looked at for what kind of cancer may or may not be growing or receding in my body. It will happen on the 8th of March, and then I see my oncologist for those results on the 9th. And hopefully in the course of those next few weeks, I will have seen the dentist and have some idea what's going on in my mouth and be able to talk to the oncologist and the dentist about what it is, how to treat it. It's just another speed bump in this journey of having metastatic breast cancer. And I was asked yesterday, aren't I upset about having something else happen? Well, it's not hurting me. I'm not in any pain from what's going on in my mouth. I wouldn't have even known it was there if I hadn't felt the little torus that's growing in the center and then taken a better look at the roof of my mouth, then noticed that I had this, large, from like my back molar to almost my front tooth where it's super swollen behind my teeth. I wouldn't have even noticed it. I didn't feel it. It's not hurting. My teeth aren't discolored or appearing abscessed in any way. So it's not that. I feel like I'm rambling. I'm just kind of ranting. But those are the things that are going on, and those are the things that I'm thinking about what's going on, and those are the things that are being done about what's going on. So as soon as I know anything more from seeing the dentist and having my CAT scan and talking to the doctor, I will let you know. But yeah, that pretty much covers it. If you have any questions or comments, please leave them below this YouTube video or comment on my site, lesliescancerconfessions.com. You can also find me on Facebook. I'm public. I'm Leslie Bolus. And if you want to tweet me, you can find me at Mo's Girl Forever. On Twitter, it's literally MOSGRL, the number 4 EVR. I know, it's weird, but apparently somebody already had Mo's Girl Forever. It wasn't me, but actually FOREVER. So I had to change it. Yeah, that is all. I hope you guys have a great weekend and enjoy yourself. Take care, stay healthy, and I will update you next week on Tuesday. Bye.